If we were to grossly oversimplify, pregnancy is basically a pathology of the human body. You spend an inordinately amount of time in a suboptimal posture that is basically an anterior pelvic tilt and a rib flare. And so many women don't get any follow-up physical therapy or care after pregnancy to help them reset the pelvis so you can get out of pain. There's a ridiculous amount of women who postpartum feel low back pain, sacroiliac pain, hip pain, and knee pain. And this is a great way to get started at getting your body back. And when I say that, I don't mean losing the pounds you gained during pregnancy. I mean literally getting back a body that works and moves and functions, even though you continue to be under a tremendous amount of distress, which is called child rearing. So the first and most simple exercise to sort of reset that pelvis and begin to orient you back to a normal non-open position is done in the back. This is the most important of the three exercises I'll show you today and should be where you start, especially if you have discomfort or pain when you're doing any of the other ones. So to start, you'll need some kind of elevated surface. This could be a chair. I'm using a block simply because we have it here. I do it on the couch at home, and a block to place between your knees, or a small firm pillow. In a pinch, you can always use a nice thick novel, a nice beach read. Set yourself up on your back. You're looking for a 90-degree angle right at your hip joint and at your knees with the block or the pillow in between your knees. Now, for most people, left heel out only will suffice, but after pregnancy, both heels out is going to be the most likely needed orientation unless you've been told by your physician that you are a left AIC. So you're looking for your heels to be slightly wider than your knees are, so you have a slight internal rotation, and throughout the exercise, you'll be squeezing in on this block. The second important point to note is that we're looking to activate your inner thigh muscles and your hamstrings. So to start, place your hands right on your belly and curl your tailbone up towards your chest, almost like you would do if you were doing a crunch in a fitness class. And if you're postpartum, it's very common that there's a separation here. And this type of activity, activating your rectus, the thin muscle that goes from pubic bone to xiphoid process, is actually going to make things worse. And we're not looking to make that muscle stronger. In fact, during this breathing exercise, we want the rectus abdominis to stay out of it. Looks great on the beach, but doesn't have a lot of purpose here for us in breathing. In fact, what we want to activate are your hamstrings. So try driving your heels, knee block between the knees, driving your heels down into the couch or the chair or the box, and see if you can slightly curl your tailbone under with a hamstring contraction. We're going to maintain this throughout. Tailbone never touches the ground, and this is where we begin the breathing. I'll take my arms to the side so that you can see through my spine. In terms of your neck, let's just make sure we're all in the same position. Slightly neck up, CPR neck position. If you find when you're breathing that you are really straining in the neck, actually take a washcloth, roll it up and stick it back there. We're going to try to get you to be a non-neck breather by the end of this exercise and this activity. So squeeze in on the block, drive heels down into the box, curl your tailbone under, fire and activate your hamstring muscles. Inhale normally. And as you exhale, blow out by your mouth and dial your ribs down towards the floor. So that will help you to curl the spine, tailbone comes up more, and hold this position. Keep your ribs down, in fact, touch if you need to feel it. Make sure they stay down as you inhale, and breathe anywhere that's not here in your belly. And exhale once again. As you exhale, press all of the air out. Make sure you're not activating the rectus, that you really are. Soft through here, firing through the hamstrings. Hold your exhale and pause. 2, 3, inhale. Try to breathe laterally into your rib cage. Feel your ribs spreading on the floor. If you can't breathe into the front, you'll have to breathe into somewhere else. Exhale, ribs down more, and really push that air out. I mean, shh. Hold. 2, 3, inhale. As you build your capacity, breathe in slowly and steadily through the nose, chin up, CPR neck, relax your neck. Exhale. Shh. As you build your capacity in this exercise, squeeze out every breath and hold. You may be able to hold longer than 3. Inhale. And exhale the last one. Drive your heels, squeeze the block, curl the tail, soften the rectus, blow your air out, blow, 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 blow. Hold. And come back to your neutral and relax. This exercise can be done anywhere, anytime, especially if you're suffering from a lot of pain in that sacrum or in your knees. Your goal would be to build up to 5 breaths per round for a session of 3 to 5 rounds. In the beginning, you'll probably find that you're having a hard time breathing. You might even break out in a sweat, and you can't even get to the fifth breath because you feel like you're panicking and you wish you could have some more air. No problem. So this will help you to reorient your pelvis and to work to close a little bit of this action here and help you to be able to breathe fully and deeply into your diaphragm. Now, one of the other benefits of this exercise that is really especially awesome when you are postpartum is that it is a parasympathetic nervous system activator. So it helps to calm some of that postpartum anxiety. I'm not saying it's going to make it go away, but it can help you to feel just a little bit better in this moment right now. So the next step is that we'd like you to be able to maintain that orientation as you do other things in your life. So next level, we'll take it to a hands and knees position. And if you have a block, you can use the block here, squeezing in on the block, slight outward orientation with your feet. And then here, the goal in this one is that your gaze stays forward beyond your fingertips and that your nose is forward beyond your fingertips. And we'll take the very similar action. Find your hamstrings, pull your tailbone under, and as you exhale, dial your ribs back and in. Let your sternum get heavy, curl up through your upper spine as well. Hold, 2, 3, and inhale. Try to breathe into everything backside without coming out of. This is not cat and cow. It is actually very, very, very different. Exhale. Shh. Dial the ribs back and blow all the air out. Shh. Hold. 2, 3. Inhale. Anywhere you can that's not the front. As much as you can, blow it up backside. Exhale. Shh. Hold. Inhale. Exhale, dial the ribs back more, tail down more, curl the spine more, squeeze the air out more. Hold. Inhale. Last one. And return to neutral. Same thing. You're looking for 4 to 5 breaths per round. Don't hesitate to start at 3 and build your capacity up from there, and then working towards getting in a few rounds of that per day. The next exercise is as you begin to progress. So as you start to get your pain under control, we want to be able to see if you can do this in an upright or a standing position. Okay, for this next exercise, find yourself a clear piece of wall space and squat about a third of the squat. Feet can be approximately hip width distance apart and about 7 to 9 inches away from the wall. What I want you to remember about this one is if you have not a lot of spinal flexion in your lower back and you try this one postpartum, it may make you feel uncomfortable, and that just means back your way down to the other 2 exercises till you feel better. In this position, find your hamstrings and curl your tailbone off the wall so there's a significant amount of contact between your lower back and the wall, keeping your tailbone off the wall the whole entire time. Hands out in front of you, cross the thumbs, and this time look forward as you exhale. Start to peel your thoracic spine off the wall and push your lower back more into the wall. We're never going to get the upper back all the way off the wall, so think low ribs, low spine on the wall, tailbone, upper back off the wall, and we'll do the same breaths here. Exhale the breath all the way out, dial your ribs back, squeeze it out and hold, and then inhale into all that back stuff. Exhale through your mouth, it's shh. Hold, inhale. Always inhaling through the nose to calm the sympathetic nervous system. I know your muscles are probably shaking. Exhale. Inhale into the back. Anywhere that there's not a contraction front side, breathe, expand it, breathe, expand it, breathe, expand it. Exhale. And slowly come back up to neutral off the wall. You probably get a big contraction here and maybe feel like a little bit crampy. That means you absolutely nailed it. Now, the one thing I want to remind you about getting out of this one is that the exit is to straighten your legs and step off the wall. What most of us who spend our lives in pain, in anxiety, and in anterior tilt is that we want to come off the wall after this really good resetting exercise by arching the back to get up. So this is just going to take you out of the position you just reset. And we want you to reset and feel good for the rest of the day. So keep the ribs down, straighten your legs, and then step off the wall comfortably. Give these exercises a shot and then check back in with us. Let us know how you're doing and how else we can help.